Let's talk about some routine screening and prevention that's specific to women. So let's talk about cervical cancer screening and prevention first. First thing that women think about when they think of a gynecologist, pap smears. We all know them. We all tolerate them. But why do we do them? The reason why we're getting pap smears is because we are trying to prevent cervical cancer. Relatively uncommon in the United States, but it is common worldwide, and the average age of diagnosis is age 50. That's our menopause range as well. So more than 90% of cervical cancer is associated with a strain of HPV. HPV is a small virus that we get through sexual activity. Most people, about 80%, will have HPV at some point in our lives. It's a lot of times our body will clear that virus on its own, but sometimes it can linger and stick around. And when it sticks around and lives in our cervix, over time it can cause changes to those cells that start out as precancerous, but then can become cancerous over time. This change thankfully happens slowly over the course of many years, but we want to screen and catch it early by doing pap smears. Start at age 21, and now because we add in testing for HPV, we can space out that pap with HPV testing to every 3 to 5 years, depending on your age and your prior results. People of average risk who have had normal pap smears and HPV screening can stop these exams at age 65, though it's important to note that a pap smear is different than a pelvic exam. Even if you're over 65, you should still be getting pelvic exams, which is when you see your gynecologist to do that speculum exam and pelvic exam to feel your uterus and ovaries, because it's important to detect if there's any changes to those organs, such as masses on the ovaries or on the uterus. We talked about 80 to 100% of people will have HPV in their lifetime. Well, how do we stop everyone from getting HPV? If it's so common, what can we do about it? The HPV vaccine is a great vaccine for this. It's more than 99% effective in preventing HPV infection in those who haven't been exposed. The key word there is haven't been exposed. It doesn't treat HPV once you have it. This is why we recommend that girls and boys start getting this vaccine as early as 9 to 11 years old, because now we're catching it before it even is exposed to the system. That vaccine's going to last. So we want to start young because you get significant benefit in preventing HPV when you start before age 26. There is some benefit to starting the series up to age 45 if you haven't had HPV or if you're of low risk, so that's something we can talk about. So this is good information to know, not just for you, but for your children, your grandchildren. Talk to them about getting the HPV vaccine as well. Prevention of HPV doesn't just lead to prevention of cervical cancer, but HPV can also lead to vaginal cancer, vulvar, penile, anal, and even oral pharyngeal cancers, if I can say that word, which we don't always screen for that, meaning that someone could get a throat cancer and not even know it. By getting the HPV vaccine, that could be preventable.
So for breast cancer screening, in the US, the average woman's risk of breast cancer is about 12% in their lifetime. That's about 1 in 8 women. About half of those cases over age 50 are self-detected. So that means that at home, at some point during a self-breast exam or noticing something, you brought the attention to your doctor, and that's how the breast cancer was found, rather than the routine screening that we're about to talk about. So importantly, that's why being aware of the breast and what it looks like, its general shape, contour, if there's anything there, our lumpy bumpies, and knowing when it's different. So that's what we call breast self-awareness, rather than the traditional self-breast exam that used to be really popular and thought to be one of the best ways to screen. So the self-breast exam was when you would do regular, repetitive motions to screen your own breast. Now we know that that can lead to high false alarm rates, and so the better thing is to just have a general awareness. Just know how they look. If anything changes, so that's things like changes to the skin, pain, discharge from the nipples, anything that's different should be discussed with your health provider. So when we are talking about the routine screening, so mammograms are the very fun exam where the breasts are squeezed between 2 plates, and that's how we get a good image like you see on the right to look at the breast tissue. The when to start this is kind of a difficult topic to decide. Everybody can be different, and there are several medical societies that all recommend different ages to start and how often to do them. In general, you can start mammograms between the ages of 40 and 50 and do them every 1 to 2 years. So typically in our office, we'll kind of look at your risk factors, kind of discuss, what you're thinking, what we're thinking, and together we kind of come to a decision about when you should start and then how often you should get them. But at the earliest 40 and no later than 50. And then for those who have increased risk, so that's for people who have family history of breast cancer, certain other medical conditions, you might need to start screening earlier and with different methods. Okay, so bone density screening. So we talked earlier again about one of the things that can happen after menopause is the change in your bone density. Bone is constantly turning over in our bodies and coming to different densities, which peaks at around age 30 and then will rapidly decrease after menopause. This puts us at increased risk for fracture. So the bone just becomes overall more fragile and would fracture under things that otherwise it wouldn't. So that could be like a fall from just a very small height and having fractures to the spine that are just from being a weight and just walking around. So that is actually called osteoporosis, and so that's when the bone density is so low that it increases the vulnerability to fracture. The reason it's important for us to talk about this is because about half of women over age 50 will have some kind of an osteoporosis-related fracture. Some risk factors for osteoporosis that might put you at increased risk for having those fractures are having a parent who has a hip or spine fracture. That one's important because I don't think a lot of people think of family history of bone fractures as something that you should worry about for yourself, but it is actually a risk factor. Smoking, and then also being at a BMI less than 20 or weighing less than 127 pounds, and then having more than 3 alcoholic beverages a day. So for screening, we do that with what's called a DEXA scan. Essentially, you go in and lay down on a flat table, and this thing that looks like it's out of Star Trek comes by and kind of does a scan over you. And that gives us a picture of what your bone density looks like and how it compares to other people, and if it puts you at an increased risk. So these usually start at age 65, but it might be sooner depending on other risk factors. So that's important for you to talk to your doctor or your provider about. There are certain risk factors like being on steroids for a long time, like we talked about alcohol use, and then several other things that might mean you need to get screened sooner. Similar to that, they can be repeated every 2 to 8 years, but again, more risk factors mean more screening. And those abnormal test results are an indication to start medication to help prevent or reverse the bone loss. So once again, with the estrogen and the hormone replacement therapy, hormone replacement therapy has proven to prevent bone loss in postmenopausal women who have not already been diagnosed with osteoporosis. All right, so going back into the diet that Dr. Teague mentioned a little bit earlier, so vitamin D and calcium are huge parts of bone health and making sure that bone density stays as high as possible. So there are recommended daily allowances of vitamin D and calcium. There's a lot of numbers but in general you can look at, there's a lot of great websites that can show you how much of these vitamins are in each of your foods. So for example, for vitamin D, we want people who are under age 70 to have 600 international units daily of that, and over 70 to have 800. For example, so that's in things like fatty fish, eggs, mushrooms, yogurt, cheeses. And for an example of that, 3 ounces of canned tuna has about 230 international units of vitamin D. So that can get you to half of, close to near what you need to for one meal. You can get a good amount. And then for calcium, that's leafy green vegetables, almonds, orange juice. And when you're under 50, we want you to have 1,000 milligrams per day. And over 50, we want you to have 1,200 milligrams per day. So in an 8 ounce of plain low-fat Greek yogurt, there's 261 milligrams of calcium. So you can get a significant amount just from 1 cup of yogurt. So there's websites like USDA, they have websites that can tell you can look up different foods that are high in each of these values, so you can start planning your meals and making it as easy as possible on yourself. Whenever we're talking about changing things to diet, adding supplements along those lines, do what's easiest for you. Do what fits into your diet the most naturally. We don't want you to go and change your entire diet in one day because you're not going to stick to it. So if you can just add a few things in at a time every couple weeks, that's one of the most reliable ways to make sure that you're able to stick to a healthier diet or healthier supplements. And speaking of supplements, just because we're saying vitamin D and calcium does not mean you need to start taking those supplements that you buy at the pharmacy. Those are really for people who have been tested and found to have low levels of those things and aren't able to get a diet rich enough in those or are so low that they need supplementation. So this does not mean that you need to go out and just start taking vitamin D and calcium. All right, and everybody's favorite topic of exercise. So we recommend 150 to 300 minutes a week of moderate intensity activity, or 75 to 150 minutes a week of vigorous intensity exercise. So that can be, 3 days a week you do 50 minutes, or 5 days a week doing a half an hour, just something to get up and move. For bone health in particular, there are specific kinds of exercise that will benefit your bone health. So it's not just everything, although they're good, it's good to move, but in particular, we want you to do resistance training. So that's using your body weight, using weight at the gym, free weights, anything that can be, used against just being upright will help with your bones, as well as high impact exercise. So that's your running, jumping, dancing, and then moving around and just kind of really like impacting on your joints, which sounds like it could be bad, but overall putting those joints under like a little bit of stress can really help them get back into their groove of building more bone. So for an example, you can go to the gym 2 to 3 times a week, use some weight machines, and then go jogging a couple times a week with a weighted vest, or walking around with a weighted vest. Doing something is better than nothing. And that brings me to the next point, which I don't know if anybody has seen this wonderful person. Her name is Natalie. So recently in October, she became famous for being the most birthday woman to have ever completed an Ironman at 80 years old. We don't all have to be this. This is awesome. This is great. However, you don't have to hold yourself to this standard. This is unreasonable. In fact, we don't want you to go from doing nothing to trying to do Ironmans, because that can hurt your joints. So we want you to just start with any movement. Start with something. Start with swimming, yoga, on a walk, and then kind of build yourself up to whatever's right for you and for your lifestyle.